Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor, imaging MRIs are something that we understand when to order, why to order, and it is something that most of medicine doesn't seem to really have a grasp on. Before we get into this particular study demonstrating just how overused these are, make sure you like this video, share it with somebody you think needs information, and subscribe to the channel. So that being said, we have known for a long time that there is a drastic overuse in advanced imaging, specifically MRI, especially for the spine. We do CT scans, we hand them out like candy to cancer patients. That's never made any sense to me because CT scans contain ionizing radiation, MRI does not. But the problem is that sometimes we find a lot of stuff on MRI that really isn't relevant. I'll have a patient that comes in and they've got raging pain down the right, and we do an MRI and the right is perfectly okay and they've got a bunch of stuff on the left. That's not that uncommon. The problem is people start getting this idea in their head when they find something on MRI. They're like, oh my God, I'm broken. And it starts this cascade of event. People who have MRIs are more likely to have injections. They're more likely to have surgery. Well, the MRI didn't change anything structurally. It just changed how we're perceiving the condition that we have. And so I do an awful lot of talking people off the ledge from MRI findings from another doctor that was ordered. And often, like when we order an MRI, unless there's some red flags, we usually order the MRI if something just doesn't make sense, and whatever we find in the MRI is going to change the clinical picture or how we're treating the patient. So if I think the patient has enough signs of a disc bulge, a lot of times we won't need to order it. We will treat it as if it's a disc bulge, and if it responds, then guess what? We were right. And most often those cases do. However, that's not the case in a lot of providers' offices. We overuse them. And so this study was interesting because they looked at over the course of what happens when somebody gets a repeat MRI. And I see this all the time. People are like, oh, I'm going to go get another MRI. My doctor ordered it. And there really hasn't been anything that changed, but maybe the patient thinks that something might have. That's usually not the case. Usually the second MRI doesn't really show anything new. And so in this case of 460 MRIs from 289 patients, so maybe they have multiple MRI or different regions, but these were a second MRI ordered within 2 years. So that could be 6 months, that could be the full 2 years. And here's what they found. In the initial MRI, the clinical rationale, so like the doctor was asked, like, why did you order this? 47% of them didn't really have a good indication for ordering the MRI. In the second MRI, it was 55% of the doctors didn't have a clinical rationale for ordering an MRI. Something was changing, maybe the patient had cancer. There are definitely reasons to order another MRI, but in a lot of these cases, there just weren't. And so what did we find? In 40% of them, there was no change whatsoever. And in 90% of the changes were mild. So we just wasted resources, time, and everything, and it didn't really change anything. In 79% of them, there was no change to the treatment plan. Remember, when you order even plain films, but definitely advanced imaging, this should be guiding you either staying on the same clinical or same treatment plan, or the findings we think are going to change the treatment plan. And then 12%, in 12 of them, surgery was indicated. Now, again, there's a time and a place to order. Maybe something changes dramatically in the patient's symptoms, or they had another trauma, or maybe they've had cancer or something. There are reasons. And so the fact that they found 12% that surgery was indicated probably makes sense. But the idea that 90% of these images had no real changes that certainly match the patient's symptoms is pretty much what I see in my office. So just because we can order the MRI doesn't mean it's a good idea. I can't tell you how many times I have a patient they're like, oh yeah, it's that disc bulge in my neck that I got 20 years ago. I'm like, no, it's not. What they found on MRI 20 years ago is not what you're dealing with today. It may be a part of the landscape, but that disc bulge you had in 1992 is not what we're dealing with today. So a lot of that, though, does boil down to the provider being able to educate the patient. If the provider doesn't understand and doesn't communicate well with the patient, there's just some confusion, and we're going to rely on the imaging to maybe give some ideas of what to do rather than clinical rationale. So, as always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.